Okay, so this is for lab. So um, I told the people at the question answer on Wednesday that I would do some videos on lab stuff, lab parts. So let's just start with skull anatomy. Okay, so one of the big things is remember, you have to remember that the skeleton is composed of two things, right? So they call it the axial skeleton and the appendicular skeleton. So the axial skeleton is the skull, the vertebral column, and the rib cage, those are supposed to be ribs, which isn't very good. Okay, then the appendicular skeleton is everything that attaches to it and where it attaches. Okay, so the pectoral girdle is where the upper limbs are held in place, and the pelvic girdle is what holds the lower limbs in place. Okay, so on this picture, you're going to see the axial skeleton is highlighted in blue. Okay, and then the appendicular skeleton is white or cream colored. Okay, and it kind of lists on this picture, which this is from your textbook, right? It lists all the bones in general, so big picture stuff. So this is a good place to start. Okay, so bone markings. Some things that are important to learn and to remember is when things articulate, that's where bones come together. So we have condyles, which are large, smooth, and they can be round or oval shaped. Facets are flat, shallow surfaces. A head is a round, kind of big epiphysis or end. So like here is the head of the femur. Okay, and then a trochlea is the, let's see if they even have it on here. You can't see, I don't think they give you a trochlea. Trochlea would be like in here. Okay, now depressions, there's several names for depressions. So alveolus, that's where your teeth go in. A fossa is a shallow depression, and we find those in the skull. And then a sulcus is a narrow groove. Okay, then there's a list of things that are where tendons and ligaments attach. So there are crests, and I'll kind of point them out as we go through it. And then openings and spaces. We don't spend too much time with these projections, but then the openings and spaces. Okay, so a canal is kind of like a canal, right? It's a passageway that goes through a bone. A fissure is a crack. A foramen is a hole. Okay, a meatus is a passageway that goes through a bone. And then a sinus is a hollow space inside of a bone. Okay, so here's the pelvis. Okay, so here is a facet. Okay, and it's going to be where things articulate. A crest is the raised edge. A fossa has a depression. A spine is also a raised edge. Okay, there's a line, which is just a ridge. A foramen for a hole. And a ramus is a process that's going to stick out. Okay. A meatus is the best one of those, is where your ear is. There are canals in the skull. Foramen, there are also holes in the skull. And there's the alveolus, is where the teeth go into the skull. Okay, so let me try to switch pages. Okay, so we spent almost a whole week on the skull. So the skull is made up of 22 bones. There are cranial bones and there are facial bones, and we don't make you learn all 22. Okay, so the facial bones are going to form the face. Okay, most of the bones are paired. Okay, so that means there's one on each side. Okay, one that's not paired is the vomer, which is the bone in your nose. Okay, cavities of the skull. The cranial cavity is where the brain sits. There are eye orbits where the eyeballs sit. There is an oral cavity, which is your mouth. There's the nasal cavity. And then there are sinuses above your nose. Okay, so if we look at this, here are some cavities of the skull. So this is a coronal cut, so we're cutting the front off. So cranial cavity is where the brain's going to sit. There's the eye orbits. Okay, nasal cavity is in here, right? So sinuses are spaces within the skull, so chambers within the skull. So there's a frontal sinus. I always think of my sinus headaches or my frontal sinus. Okay, maxillary sinus is above the maxilla. And then the ethmoid sinuses are part of the ethmoid bone, which I'll show you here in a minute. Okay, so now in the nose, well, hold on, we'll keep going here. Okay, so if we look at the front of the skull, now you don't have to know everything on here. So look at the review list that I gave you, because it narrows it down. The review list is to help you focus on what you need to know. There's more in the book than you actually need to know. Okay, frontal bone is the bone at the front of your brain or your head. Parietal bone is the top, and that's kind of hard to see, but it's the blue. Okay, temporal bone is at your temple. Okay, so it's at the sides. Now the sphenoid bone is going to be inside. You can see a little bit of it here. You can see this purple. That's the sphenoid bone, and it's on both sides. It's actually shaped like a butterfly. Okay, so the sphenoid bone is shaped like a butterfly. Okay, now the ethmoid bone, there's only one of those, right? And the ethmoid bone, it kind of looks like a walnut. And we'll open up the picture of the skull and you'll be able to see those. Okay, lacrimal is tears. Okay, so it's going to be at they're small bones at the corners of your eyes. Okay, and the nasal bone is part of the bridge of your nose. Okay, zygomatic bone is your cheekbone. Okay, or your right cheekbone. Maxilla is the upper jaw. Mandible is the lower jaw. Okay, the vomer is the bone that goes in between the septum in your noses, the cavities in your nose, in your nose. Okay, all of these things that aren't bold, you don't have to worry about. Okay, so if you look at the skull from the top, okay, you're going to see sutures. Okay, so coronal suture is separating the frontal bone from the parietal bones. Okay, so frontal from the parietal, here's the zygomatic, so your cheekbone. Temporal is right at your temples, right where your glasses are, the arms of your glasses are. Here's the sagittal suture. Okay, so you should know that. You should know lambdoid suture. Okay, and then occipital bone is at the back of your skull. Okay, so remember, these match up with the lobes of the brain. So that makes it a little bit easier. A sutural bone is a bone that's actually enclosed by the sutures. So everybody doesn't have the same ones. Everybody's are different. So and it's not a big deal to know those. It's just kind of it's almost like a Jeopardy fact. Okay, now if you look at the back of the skull, okay, so here you're going to see parietal bones, right? And there's the sagittal suture. Okay, then you have the lambdoid suture and the occipital bone. Okay, then the mandible, so it's down below here. Now we're going to talk about the mastoid process. I'll try to show you from a side view. Okay, so if we look at a lateral view, all right, let me get the highlighter. Okay, so you should know parietal, right? So we're just repeating things over and over again. Frontal. Okay, now you can see more of the sphenoid bone. Okay, so the sphenoid bone is this purple right in here. And it looks like a butterfly. When we take the skull cap off, you'll be able to see it. Okay, so the nasal bone again. Okay, lacrimal, at the corner of your eye. Ethmoid is deep in here, and you can start to see it. It looks kind of pink. They colored it pink. The zygomatic bone, okay, the maxilla, the mandible, okay, occipital is in the back, okay, temporal and sutural. Now, two processes that you should know, okay, the big process here is the mastoid process, and then there's a little pointy one here, and it's called the styloid process. So it's kind of like a pen or a stylus sticking out. Okay, here's the hole for your ear, the external auditory meatus, or they're calling it the acoustic meatus. Okay, now the processes that come off of them are named by what they're going to hook up to, right? So this is the zygomatic arch. So this is the zygomatic process of the temporal bone. Okay, this is the temporal process of the zygomatic bone. And I'm pretty sure I don't have those on your list, but a process is something that's going to stick out. Okay, so it's where two things are coming together. Okay, so if we look here, all the same bones, right? Just a different view. So if you look inside, okay, they're trying to get you to see the ethmoid bone. Okay, so the ethmoid bone is in here. Sphenoid is here. Okay, so if you look from the bottom, okay, so this is if you took a skull off of somebody's spinal cord and you turned it upside down. Okay, so here's something you should know. So the foramen magnum, this is the big hole where, so foramen is a hole and magnum is big, right? So it's a big hole and it's going to connect the brain. It's where the brain stem leaves and hooks to the spinal cord. So that's coming out of this hole. This external occipital protuberance is just something that's cool. It's the knowledge knot. It's the bump on the back of your head. Okay, so there's your occipital bone. I want you to see the sphenoid bone here. Okay, so here is the sphenoid bone, and it's kind of shaped like a butterfly. Okay, palatine process is part of the maxilla, rather, and then the palatine bone is here. Okay, so that's your hard palate. That's your palate. That's the top of your mouth. I don't make you learn all of the holes and all of the processes. You need to know styloid process, mastoid process, which I don't even see on this. Yeah, there's mastoid process. But you know, don't have to know all the other stuff. Okay, so there's the vomer. There's the nose bone. Okay, now if you take the cap, the skull cap off a skull, okay, and you take the brain out and you look inside, okay, so here's foramen magnum. So there's the big hole in the middle, okay, where the spinal cord's going to pass through. Parietal bone, okay, temporal, frontal, okay, ethmoid. So this, I think this is a good view of the ethmoid. Okay, then the sphenoid. Okay, so here's the sphenoid. It's all of this purple. And to me, it kind of looks like a butterfly or a moth or a bat or something. Okay, now in this bone, okay, there is a little fossa. Okay, this is actually like a dip, and it's a saddle. So if you think about a saddle that you might ride a horse, use on a horse, right? So what that is called is that's called the sella turcica. So it's a Turkish saddle. So it's this little space in here. And in that space is where the pituitary gland actually sits. So if you think about the pituitary gland hanging off of the brain, it sits in this little space in the sphenoid bone. Okay, now another thing about the ethmoid bone is the ethmoid bone has if you looked at it from the side, it has a thing that goes up like that. It's got a little sail on it. And that sail is called the crista galli. Okay, in the ethmoid bone here, I'm going to make little dots. Okay, so there are little holes in there, and that's called the cribriform plate. So your olfactory nerves lay in here. Okay, so that's the part of your brain. It's laying right in there. And then those little nerves that help you smell, right? They go down through these little holes and into the nasal cavity. Okay, so now in the front of this, they call these the anterior fossa. Okay, so remember, a fossa is like a little lake. So anterior fossa, middle fossa, and posterior fossa. So those are the depressions, and that's where the brain is going to sit in the skull. Okay, so that's just like little, and there's one on each side. So we're pretty we should be symmetrical. Okay, so internal bones of the skull. So here's another picture trying to show you the sphenoid and the ethmoid. Okay, so here's the sphenoid. It's the purple one, right? The ethmoid is the one that looks red. Okay, the vomer is yellow. Palatine bone they've made green. Okay, now in your nasal cavity, okay, so this is the vomer, and then this is your nasal cavity. In here, there are ridges, and we talk about them when we get to the respiratory system. Those ridges are called the inferior nasal concha. So they're ridges, and what they do is they increase the surface area. So when you bring air in, it gets moistened and cleaned out before you inhale it into your lungs. Okay, so here's another picture. Here's the fossa. So there's anterior, there's middle, there's posterior. Okay, so if you look, the cerebellum is sitting in the posterior, the temporal lobe is sitting in the middle, and the frontal lobe is sitting in the anterior. So it's pretty kind of nifty. Okay, so now the eye orbit. Okay, so there are lots of bones that make up the eye orbit. So it's kind of crazy how many bones there are. Okay, so if you look at the eye orbit, there's 7 bones. Okay, so you have the frontal, right? You have sphenoid. Okay, then you have zygomatic. You have the maxilla. You have the palatine. And you have ethmoid. And you have lacrimal. Is that right? 1, 2, 3, 4, 5, 6, 7. Yep. So there are 7 bones that make up the eye orbit. And that's a good test question. Okay, what are the 7 bones that make up the eye orbit? The nasal complex, this is just to try to show you the concha, which we end up spending a lot of time on, or not a lot, but some time on this in the respiratory system. So next semester. Okay, so if you look at the nasal complex, it's not smooth. Okay, there are rolly, scrolly things in there. Okay, so those things are the concha. And the idea is they're going to increase the surface area that the air passes through on its way into your respiratory system. Okay, sinuses. So I kind of already hit on those. So frontal, maxillary, okay, sphenoid, and then ethmoid. There's a side view. The hyoid bone. So the hyoid bone is at the top of your larynx, and it's just shaped like this. It's the only bone in your body that doesn't articulate with another bone. So it doesn't articulate with another bone. Okay, but it is a point of attachment for tendons and ligaments. Okay, so that's what it's about. So it's in the top of your throat. It is used in forensic pathology because it can break if you're strangled. Or if it breaks, it's possible that it cuts off your air passageway. So hyoid bone. Sex differences in the skull. This is just always interesting. So female features, they're more delicate and small, and the male features typically are bulkier, but it depends, right? It's not black and white at all, right? It's very, very kind of, I don't know how to describe it. It's very, I guess, fluid. So everybody's not the same. So there are some features, like the female's chin is usually pointier, the male's jaw is usually bigger, the cheekbones are bigger. I mean, there's some dimorphism, some differences, but I don't think you can say it's definitely everything is one way or the other. Okay, now the fetal skull, what I want you to look at are the fontanelles. Okay, so there is an anterior fontanelle. Okay, so when you are born, all of the bones in your body are not fused together, and especially the bones in the skull. So you have two frontal bones, and in between them is connective tissue. So the connective tissue is open until maybe, it depends, they all close at different times, but maybe like at 2 years old, they're closed off. So it gives room for the brain to expand. And when you're giving birth, the skull can kind of be constricted, right, or pushed in rather than having this big solid head come out. Okay, so they're called the fontanelles, and lots of times people call them soft spots, right? Well, the proper anatomy term is fontanelles. So the anterior fontanelle is at the front. Okay, there's a sphenoid fontanelle, which is at the temple. Okay, the mastoid fontanelle is more towards the back, but at the side. And then the posterior fontanelle is at the back. Okay. And I think that's that.